Welcome, everyone. I'm Kim Hanson, Executive Director at Diabetes Canada. We're here today to talk to you about how those of you in the South Asian community and otherwise who are living with diabetes or prediabetes can manage and find support during the COVID-19 pandemic. I'm joined today by MP Sonia Sidhu, the Member of Parliament for Brampton South and Chair of the All-Party Diabetes Caucus, and also by Shabnam Jabrani, a certified diabetes educator with the Humber River Family Team. Welcome to you both, and thank you so much for being here.
Thank you.
Thank you, Kim.
We'll be delivering today's remarks in both English and in Urdu, and we really hope that you'll find it useful. We would certainly invite any of you watching to ask questions at any time using the chat function at the bottom of your screen. And I just wanted to make you all aware that we are recording today's session. We'll be making it available on our YouTube channel after the fact, so you can review it if you'd like or share it with your networks. Today, our experts are going to be answering some key questions that MP Sidhu has been receiving to her office, that we're receiving here at Diabetes Canada, about the relationship between COVID-19 and diabetes, and about how you in the diabetes community can access support. So we'll be covering a number of different things during this time, and we hope you'll find it helpful. MP Sidhu, let's start with you. What is the federal government doing for Canadians affected by diabetes during COVID-19?
First of all, thank you, Kim. Hello to everyone joining us with Tally Town Hall. And today, I'll talk about what the federal government is doing towards diabetes. First of all, today's Tally Town Hall is we are just hearing of residents' concerns. And first of all, I also want to say Ramadan Mubarak to all those in Brampton South who are on the call, who are observing at this time, because this is a fasting time. It's they call Rosa. So Ramadan Mubarak to all our Muslim brothers and sisters. And today's Tally Town Hall, that is why we are doing in Urdu, because of this is a very, very important how we are taking care of the diabetic population. So I will talk about that, like what our government is doing for that this time. Like we are all going through a very difficult time, and our government of Canada has taken broad action to assist many Canadians as possible during this challenging time. As you know, investing $240 million to improve virtual care so that Canadians can get help when they need from their homes. With this help, this virtual program to see family physician, it is a great program, even though I'm a member of health committee, and on the last committee meeting, I heard loudly, it's really helpful virtual care. You can see a doctor, and you can see specialist, and it's such a great thing. And beside that, Canada Emergency Response Benefit, Canada Emergency Student Benefit, Canada Wage Subsidy, more support for seniors. And I'm getting so much positive feedback. And for the mental health, for the kids helpline, I think that this is the great thing. We are here to support Canadians and their families now and in the future as we get through this pandemic together. And Diabetes Canada is doing great things. Thank you, Kim, for your leadership. And you were in the health committee with Russell Williams. And I really want to say thank you. You were there for the diabetic population. Keep it up, good work.
Thank you, Sonia. It wouldn't be possible without you in any way. Would you maybe care to repeat any of that in Urdu before we move on?
Oh, yes. सबसे पहले तो मैं अपने मुस्लिम ब्रदर एंड सिस्टर को रमदान मुबारक बोलना चाहूँगी. This is a holy month when we are observing, हम फास्ट कर रहे हैं, तो बहुत ही ज़रूरी हो जाता है कि डायबिटिक पॉपुलेशन, अगर कोई प्रॉब्लम आती है तो where to reach. इसीलिए ये जो हम लोग आज की टेली टाउन हॉल कर रहे हैं, तो आपको काफ़ी जो मुश्किलें आती हैं वो आसान हो जाएं. So हम आपके लिए शबनम is here with us, Kim is here with us. So हम लोग आपकी ज़ुबान में आपको बताएं कि आप क्या कर सकते हैं, कहाँ आप रीच आउट कर सकते हैं. क्योंकि जब हम लोग फास्टिंग करते हैं तो सो डायबिटीज जो हमारी फ्लक्चुएट करती है. सो इसीलिए जब हम लोग आज आपके सामने जो टेलीटाउन हॉल रखी है, आपके क्वेश्चन जो आंसर करने हैं, तो जो किम ने मेरे से सवाल पूछा है कि फेडरल गवर्नमेंट वो क्या कर रही है. जो वर्चुअल केयर $240 मिलियन जो फेडरल गवर्नमेंट ने अनाउंस की है कि वर्चुअल केयर कोविड-19 के जब हम लोग दरमियान से गुजर रहे हैं तो मुश्किल हो गया है कि डॉक्टर के पास पहुंच करनी. इसीलिए आप वर्चुअली आप डॉक्टर देख सकते हैं, फोन करके आप अपॉइंटमेंट बना सकते हैं. सो ये इजी हो गया है आपके लिए. अगर आपको डायबिटीज मसलन कोई प्रॉब्लम है तो आप स्पेशलिस्ट देख सकते हैं, इंडोक्रिनोलॉजिस्ट देख सकते हैं वर्चुअली. सो और जो हम लोग कर रहे हैं कि कनाडा इमरजेंसी स्टूडेंट बेनिफिट के हिसाब से स्टूडेंट्स की हेल्प कर रहे हैं. वेज सब्सिडी, कनाडा वेज सब्सिडी और सपोर्ट फॉर सीनियर्स के लिए बहुत जो अनाउंसमेंट की आगे जाके वो मैं बताऊं कि हम लोग सीनियर्स के लिए क्या कर रहे हैं. सो आज की जो टेलीटाउन हॉल है ये सभी यही बेनिफिट्स बताने के लिए है कि फेडरल गवर्नमेंट क्या कर रही है आपके लिए, डायबिटीज कनाडा क्या कर रही है. तो शबनम आज हमारे साथ हैं, वो भी आपको बताएंगे. हेल्थ के प्रोफेशनल है शबनम, वो भी आज आपको बताएंगे. पॉलिटिक्स आने से पहले आई हैव 18 इयर्स, 18 साल का एक्सपीरियंस है बिकॉज मैं हेल्थ केयर प्रोफेशनल थी यही. तो इसीलिए मेरा हेल्थ कमेटी की मेंबर भी हूँ मैं. तो डायबिटीज जो हमारी कॉकस है उसकी चेयर भी हूँ. इसीलिए जो आज आपके सामने हम लोग लेके आए हैं हम आज टेलीटाउन हॉल, ताकि आपको हेल्प हो सके. सो थैंक यू वेरी मच. नाउ बैक टू यू किम.
Thank you so much, Sonia. Now, you couldn't be a much stronger supporter and champion of the cause of diabetes. And so we thank you from the bottom of our heart for all that you do on Parliament Hill in the name of supporting people with diabetes. I know that diabetes is a large burden for many in the South Asian community, many in the Brampton area. Talk to us about that and how that's influenced your focus on diabetes.
So, Kim, it's a great question. Diabetes affects many Canadians. Every 3 minutes, another Canadian is diagnosed with diabetes. It's a major cause of strokes, heart attacks, kidney failure, lower limb amputation. As you know, First Nation population living on reserve, a rate of diabetes extremely high. When I think of my city, Brampton, every sixth or seventh Bramptonian is affected with diabetes or pre-diabetes. Rate is the high, as you know, amputation rate is very high in Ontario. Awareness and prevention are the key. So on the last parliament, my motion unanimously is passed for November as a diabetes awareness month, which I was very happy. But this on this parliament, my bill is coming. I'm very excited about that. But presently, many people in Brampton are observing Ramadan. During this time of fasting, it is important to remember to ensure their physical health is being taken care of. That is why, as I said, we are doing this. It doesn't matter you have a type 1 or type 2 diabetes, speak with the healthcare professional either in the clinic or virtually over the phone. But today we have a Shabnam, we have a Kim. I think it is very important teletown hall. We did that before in the Punjabi language with the Dr. Harpreet Bajaj. But today I think it's excellent effort, and kudos to Diabetes Canada. So Diabetes Canada is always there. When before COVID-19, we did many great efforts, even on the hill. As I told, like I'm a member of Standing Health Committee, chair of Diabetes Caucus, and particularly, as I told, I'm very, very excited of my private member bill, which is National Framework for Diabetes Act. That will, ensure that our government has a framework to place to support improved access for Canadians to diabetes prevention and treatment. And because we gave the insulin to the world, why we cannot lead the way? So I now will speak in Urdu. सो जैसे कि आप जानते ही हैं कि डायबिटीज जो है हर 3 मिनट में एक जो इंडिविजुअल है वो डायबिटीज का शिकार हो रहा है इसीलिए मोस्टली ब्रैम्पटन में हर एक 6th और 7th इंडिविजुअल डायबिटीज और प्री डायबिटीज का शिकार है इसीलिए बहुत इम्पोर्टेंट है इस रोग को रोकथाम करना हमने इंसुलिन जो वर्ल्ड को दिया है तो व्हाई नॉट हम लोग इस इन्वेंशन के लिए क्यों नहीं हम कुछ कर सकते इसीलिए मैंने जो लास्ट पार्लियामेंट में एक मोशन पास करवाया था कि नवंबर एज ए डायबिटीज अवेयरनेस मंथ मनाएं तो इस पार्लियामेंट में मैंने एक बिल जो है वो टेबल किया है जैसे नेशनल फ्रेमवर्क ऑफ डायबिटीज एक्ट इसी के हिसाब से डायबिटीज को बहुत प्रिवेंशन और ट्रीटमेंट के लिए सभी प्रोविंस में मदद मिलेगी इस डायबिटीज की प्रिवेंशन और एजुकेशन के हिसाब से और जो कि हमें बहुत ज़रूरत है इसमें तो लास्ट पार्लियामेंट में हमने रिसर्च में काफ़ी जो पैसा दिया है फेडरल गवर्नमेंट ने लेकिन हमें और बहुत ज़रूरत है बहुत कुछ आगे करने के लिए जो आज की जो टेलीटाउन हॉल है डायबिटीज़ कनाडा किम और शबनम जो आपको जानकारी देंगे सो इट इज़ इम्पोर्टेंट वर्क आपके लिए तो हम तो थैंक यू करते हैं डायबिटीज़ कनाडा का हमारे हेल्थ केयर प्रोफेशनल जो काम कर रहे हैं चाहे वो फ्रंट लाइन पे कर रहे हैं डायबिटीज़ के लिए कर रहे हैं आई रियली वांट टू से बहुत बहुत उनका शुक्रिया
Thank you, Sonia. Now I'd like to welcome Shabnam Jabrani. Shabnam, um, many Canadians are wondering whether they're at greater risk to COVID-19 because they live with prediabetes or diabetes. What would you tell them?
Mm-hmm.
Well, thank you first of all for including me in this session. I really appreciate that. I'd like to state that in people with diabetes, the COVID-19 risk is just like the flu virus risk. The people with diabetes, they have a higher chance of getting infected with the virus. As per research, people with diabetes have risk for severe infection. It doesn't mean that everybody will have a severe infection. For example, if in the general population, 80 to 85% is the rate of infection, which is quite mild. So the rate of severe infection is usually 10 to 15%. And maybe that rate of severe infection, which could mean possibility of pneumonia or hospitalization or even being admitted to the ICU, that rate is doubled in people with diabetes. As Sonia mentioned, people with diabetes have a compromised immunity system, which is the reason for the high severity. So coming to what should people with diabetes do, just what everyone else should do basically. People with diabetes should be more cautious and follow all the public health protocols of social distancing, hand washing, hand sanitizing, which is truly important for everyone to stay healthy during this COVID-19 pandemic. Meanwhile, even though we want to be focused on COVID-19, we shouldn't forget about our diabetes care itself. If you have diabetes, keep doing, in fact, better for blood sugar monitoring at home, blood pressure checking at home, make it your priority. Manage your blood sugars as much as possible in the current circumstances. Even like checking your feet at home using a mirror if you can't bend, things, self-care like that can kind of help you to manage your diabetes better. Eat as healthy as possible, take your medications, adjust the doses if needed, if you're active or inactive due to physical distancing measures, and get exercise like walking, yoga, and there are a lot of online exercise programs also available which one can participate in. If you have any questions about diabetes, Diabetes Canada is here to help you. You can call the 1-800 Banting line, which is BANTING Banting, and a certified diabetes educator will usually respond within 24 hours. You can also access Diabetes Canada website for COVID-19, where there are lots of resources available. Now I'm going to translate this in Urdu. फ्लू वायरस की तरह डायबिटीज के मरीजों को भी कोविड-19 के वायरस का खतरा आम लोगों के मुकाबले में ज्यादा है। तहकीक के मुताबिक हमारा ये मानना है कि डायबिटीज के मरीजों में शदीद इन्फेक्शन हो सकता है, जैसे कि निमोनिया या ज़्यादा हॉस्पिटलाइजेशन या आईसीयू में एडमिट होना, और इन्फेक्शन की तादाद दुगनी होने के इम्कान ज़्यादा है। तो हमें क्या करना चाहिए? कोविड-19 पर तवज्जो रखें, लेकिन उसके साथ साथ अपने ब्लड शुगर पे भी ध्यान रखें। मौजूदा हालात में वर्जिश करना ना भूलें। मिसाल के तौर पे वॉक के लिए चले जाना, योगा करें या ऑनलाइन एक्सरसाइज प्रोग्राम्स में शामिल हो जाएं। इसके साथ साथ मुतवाज़िन ग़िज़ा लें और अपनी दवाइयाँ वक्त पे लेना ना भूलें। सेहतमंद रहने के लिए और कोविड-19 से बचने के लिए हाथ धोना ज़रूरी है और 2 मीटर का फासला रखना बहुत बहुत ज़रूरी है। अगर आपके कोई कोविड-19 और डायबिटीज़ को लेकर सवालात हैं, तो डायबिटीज़ कनाडा से राब्ता करें। उनका फ़ोन नंबर है 1-800 बैंटिंग, और 24 घंटे में डायबिटीज़ एजुकेटर आपको कांटेक्ट करेंगे। मज़ीद मालूमात के लिए डायबिटीज़ कनाडा की वेबसाइट से आप ले सकते हैं। Over to you, Kim.
Thanks so much, Shabnam. That was fantastic. Now, people might be wondering how they can access care during the pandemic and how they can care for their diabetes on their own at home. What is your advice for them?
So people think that due to COVID-19 situation, they cannot access any emergency services or go to their doctor's office. But I would like to emphasize that if the individual is experiencing any health emergency or COVID symptoms, then they should, especially people with diabetes, they are likely to have high blood sugars and may end up with diabetes ketoacidosis. So in that case, it's absolutely safe to go to the emergency. There are lots of doctors' offices who are offering like telephone appointments. Even you can contact your specialist or your diabetes education team through telephone appointments. Pharmacies are offering free delivery, although I know that the medications are just being given for a month, 1 month supply. And some people may have a problem with that because they have to pay the prescription fee each time that they get their medications. But there are lots of other benefit forms available, like the co-pay for seniors form, where you just pay $2 for the prescription fee. So those forms are available, and I wonder if it's on the Diabetes Canada website. People can access it from there. There are lots of free resources online which can also benefit people with diabetes. And if you are living with pre-diabetes, you can access the Canadian Diabetes Prevention Program, which is a partnership between LMC Healthcare and the Public Health Agency of Canada and Diabetes Canada. So if you access this program, they usually get you in touch with a health coach who can sort of help you out regularly through regular appointments online for a period of time, for 1 year. So I'm going to repeat this information in Urdu. इन हालातों में अगर आपकी सेहत बहुत ज़्यादा बिगड़ जाए, तो हॉस्पिटल के इमरजेंसी डिपार्टमेंट में बिना झिझक चले जाएं। वहाँ आप बिल्कुल महफूज हैं। जबकि रूबरू अपॉइंटमेंट्स आजकल बंद है, लेकिन आप अपने डॉक्टर या स्पेशलिस्ट से फ़ोन पे राब्ता कर सकते हैं। कुछ वॉक इन क्लिनिक्स भी खुली हैं। आपकी सेहत के लिए कुछ मुफीद मशवराएं इस तरह हैं। आप अपने पैरों की जांच रोज़ाना करें। अगर आपको झुकने में तकलीफ होती हो, तो शीशे को ज़मीन पर रख कर उसमें उसका अपने पैरों का अक्स देखकर आप उसका चेक कर सकते हैं कि आपको कोई ज़ख्म वगैरह ना हो। आपका ब्लड प्रेशर और ब्लड शुगर भी घर पर चेक करें, ताकि आपको अंदाज़ा हो कि ये काबू में है या नहीं। ज़रूरत पड़ने पर आप अपनी हेल्थ केयर टीम से राब्ता कर सकते हैं। अगर आपको प्री डायबिटीज़ है, तो कनेडियन डायबिटीज़ प्रिवेंशन प्रोग्राम की सहूलत इस्तेमाल करें, जो पब्लिक हेल्थ एजेंसी ऑफ कनाडा, एलएमसी और डायबिटीज़ कनाडा ने आपके लिए फरहम किए हैं। वहाँ पर आपको 1 साल के लिए फ्री हेल्थ कोच दिया जाएगा, जो जिसके साथ आप मुसलसल कांटेक्ट में रह सकते हैं आपकी सेहत सुधारने के लिए। Over to you, Kim.
Fantastic. Thanks so much. Now, if it would be all right with you, I'd like to take a few moments to let our viewers know how Diabetes Canada is helping people during this pandemic. And I wonder, Shabnam, if you'd be so kind as to perhaps translate my remarks for me. So now more than ever, Diabetes Canada is here to help people affected by diabetes. It's an uncertain time, and we know that many people are anxious, they're worried, they're looking for information, and we're trying to really fill that need and provide that information in as many ways as we can. For example, as has already been mentioned, we have our 1-800 Banting line, BANTING. You can also access that information center by emailing info@diabetes.ca. And we really encourage you to reach out if you're looking for information there about government programs that may be available to you either federally or in your province or territory to help with the costs of diabetes or with other aspects of living with the disease. If you have questions about perhaps things like the disability tax credit or where you might access health care or find support in your community, those are all things that our wonderful information center can help point you towards. In addition, just as of the last few weeks, we've been very pleased to offer through the 1-800 number personalized medical advice, whereby volunteer certified diabetes educators are contributing their time to answer people's calls so that they can have advice about how they can manage their personal diabetes. And so they will, if you call into 1-800 Banting, a certified educator will return your call within 24 to 48 hours and talk you through what your specific needs are. If you're someone who's living with type 2 diabetes, or maybe you know someone who is, whether you've perhaps just been diagnosed or you've been living with it for a while and would like a refresh, you can consider signing up for Diabetes Canada's new virtual type 2 education program. We have started cohorts this week and are filling up many more, so please visit our website if you'd like more details on that. Also visit our website if you'd like to know about anything really to do with diabetes and the coronavirus. You can visit diabetes.ca/coronavirus for frequently asked questions, for other resources such as an infographic that you can bring to your pharmacist if they're having questions about maybe any changes to the dosage of medication that you need. There's a letter that you can print off if you'd like to ask your employer to offer accommodations based on your diabetes. So all those are available. We're planning to bring a series of virtual conferences throughout the year, so stay tuned to our social media channels for more information about that. There will be a Type 1 conference. There will be our conference for our professional section. And this summer, because we can't hold in-person camps for kids who live with Type 1 diabetes as we normally do, we're offering them by Facebook Live, which is going to be a lot of fun, I think, for the kids. We're also supporting healthcare providers in staying current on information about diabetes and COVID-19. We're updating them with the latest research, as well as with tips on how they can provide support to their patients virtually in this extraordinary time. And so, regardless of what it is that you might be wondering about, we hope that we're able to help you. And we really encourage you to reach out to us, because when you reach out to us, it helps us know what you need. If you're experiencing barriers that we can help advocate to have removed on your behalf, all of those things help us serve the people with diabetes better. So please never hesitate to reach out. Shabnam, would you be so kind as to repeat what I just said?
Okay. तो किम ने बताया कि इन हालातों में डायबिटीज कनाडा और भी ज़्यादा आप लोगों की मदद के लिए मौजूद है, क्योंकि उन्हें मालूम है कि हम सब बहुत ज़्यादा फ़िक्रमंद है और इसके बारे में मालूमात ढूंढ रहे हैं। इनके ऑफिसेस जो है इन हालातों में भी काम कर रहे हैं और ऑनलाइन प्रोग्राम्स पेश कर रहे हैं। और मज़ीद मालूमात के लिए 1-800 बैंटिंग या info@diabetes.ca/coronavirus से राब्ता करें। डायबिटीज कनाडा का यूट्यूब चैनल और या सोशल मीडिया चैनल पर भी आपको माहिरीन के वीडियोस ताज़ा तरीन मालूमात के साथ मिलेंगे। इस साल वो लोग जो टाइप 1 डायबिटीज के बच्चों के लिए जो कैंप्स करते हैं वो चूंकि रूबरू नहीं कर सकेंगे, तो उन्होंने फेसबुक लाइव पर प्रोग्राम पेश करने का सोचा है। अब ये ऑनलाइन कॉन्फ्रेंस पर काम कर रहे हैं जो हमें माहिरीन लोगों के साथ कनेक्ट करने में मदद करेंगे। वेबिनार सीरीज के जरिए ये हेल्थ केयर प्रोफेशनल्स को कोविड-19 और डायबिटीज की ताज़ा तरीन रिसर्च से वाकिफियत दिलाएंगे। और अगर आप लोगों को कोई भी सवालात हो तो उनसे राब्ता करें, उनको बताएं कि आपकी क्या परेशानी है, तो वो आपको जो भी गवर्नमेंट के फेडरल प्रोग्राम्स है या जो भी आपको मदद कर सकते हैं वो मदद देने की पूरी कोशिश करेंगे। इसके अलावा अभी पिछले हफ्ते उन्होंने डायबिटीज एजुकेशन प्रोग्राम्स शुरू किए हैं। चूँकि पहले हम अपने डायबिटीज टीम की ऑफिस में जाकर वहाँ पर ये एजुकेशन हासिल करते थे, और चूँकि अभी ये सब बंद है तो उन्होंने ऑनलाइन ये डायबिटीज एजुकेशन क्लासेस शुरू किए हैं, जो डायबिटीज एजुकेटर्स इन क्लासेस को चलाएंगे। वो अपना वक्त वॉलंटियर कर रहे हैं इनके लिए। तो अभी अभी तक 3 क्लासेस उनकी पूरी भर चुकी हैं, लेकिन और क्लासेस वो लोग ऑर्गेनाइज करेंगे। तो अगर आप लोगों को अटेंड करना हो तो उनको कॉल करके इसमें शामिल हो सकते हैं। आखिर में गवर्नमेंट फंडिंग की जो मालूमात है वो आपको बताएंगे, और इसका भी यकीन दहानी करेंगे कि दवाइयों की तरसील मुनक़ता ना हो, क्योंकि अगर सप्लाई में प्रॉब्लम होता है तो हमें अगर दवाइयाँ नहीं मिलती है तो हमारी सेहत को वो असर कर सकता है। इसलिए वो लोग इसकी कोशिश करेंगे। ओवर टू यू किम।
Thank you so much, Shabnam. Now, it's time to take some questions from our viewers. The first one is for MP Sidhu. This viewer says, "Hi, Sonia. My name is Shazia Khan, and I'm a resident of South Brampton. I'm a senior citizen, and I have diabetes. I feel badly for putting pressure on my family. My son lost his job. I'm wondering what the government is doing to support senior citizens like myself during COVID-19. Please help me."
Thank you for your question, Shazia. As you know, Prime Minister announced there's a big announcement for our seniors. The seniors of Brampton, even in Canada, like yourself, have helped shape our community into what it is today. Many seniors, like yourself, Shazia, are expecting higher price of groceries, and it's hard to pay rent for sometimes there's many other expense it's hard to pay through COVID-19. As I told, federal government announced those to old age security will receive one-time payment $300 and GIS $200 for low-income seniors. I think it's a big help for seniors like you. And in April, I know 9 million seniors were benefited from the GST checks. So these are the straight help, but there's other help through other programs as well. And Kim, you mentioned that for Diabetes Canada is also helping people who have a hard time to buy medications. So these are the help available, and if you are eligible for the other time $500 payment, but if you don't, you can also use 1-800 banting. Sometimes there's compassionate programs out there, and you can get benefited from that. I hope this answer will help you. Now I'll speak in Urdu. सो जैसे कि शाजिया आपने बताया आप सीनियर है तो आपको थोड़ा सा हार्ड टाइम हो रहा है इसीलिए हमारे प्राइम मिनिस्टर जस्टिन ट्रूडो ने अनाउंसमेंट की लास्ट वीक आई थिंक काफ़ी सीनियर्स इस अनाउंसमेंट से खुश हैं क्योंकि ये वन टाइम पेमेंट है $500 की $300 फॉर इट्स अ GIS supplement, it's a granted income supplement, and no, 300 for old age security and 200 for GIS. So it's a $500 जो सीधी आपको हेल्प है उसके आपके काम आ सकती है अगर आप एलिजिबल नहीं है आप लो इनकम में नहीं आ रहे इस एलिजिबल नहीं तो आपको कंपैशनेट प्रोग्राम जो डायबिटीज कनाडा की वेबसाइट पे आपको वहां से आप नंबर ले सकते हैं 1-800 बैंटिंग में आप फोन कर सकते हैं गवर्नमेंट की भी हेल्प है वर्चुअल केयर भी मैंने बताया पहले आप उससे भी हेल्प ले सकते हैं कोई डॉक्टर देखने की लेकिन दवाइयों की महज जो हेल्प है आपको ये पिछले वीक जो अनाउंसमेंट से आपको मिली है आप उसका फायदा उठा सकते हैं अगर फिर भी आपको कोई और इन्फॉर्मेशन चाहिए तो आप डायबिटीज की वेबसाइट पे जाके आप वहां से भी मालूमात कर सकते हैं I hope आपको इस आंसर मिल गया होगा. Thank you for your question.
Thank you, Sonia. That's a great answer. This next question, I think, is maybe for Shabnam to answer. This is from a parent of someone who lives with type 1 diabetes, and this parent is wondering if their child is at the same risk to COVID-19 as someone that has type 2. What would your guidance be to them, Shabnam?
So according to the American Diabetes Association, at this time, we don't know if there's a difference in risk between type 1 and type 2 diabetes for COVID-19. However, how well the diabetes managed is very important. So if you have diabetes and coronavirus symptoms, please talk to your doctor. The ADA recommends having your blood glucose reading and ketone readings available, keeping track of your fluid consumption, and being clear on exactly what symptoms you're experiencing. Emergency warning signs include persistent pain or pressure in the chest, difficulty breathing or shortness of breath, confusion or inability to or bluish lips or face or bluish face. And this is what the ADA is recommending, that you watch out for these signs. So if I have to translate this in Urdu, मौजूदा मालूमात के हिसाब से अब तक ये साफ जाहिर नहीं है कि टाइप 1 या टाइप 2 डायबिटीज वालों में कोविड-19 के खतरे में कोई फर्क है, लेकिन आप अपनी डायबिटीज किस तरह काबू में रख रहे हैं वो ज्यादा इम्पोर्टेंट है. अगर आपको डायबिटीज है या कोरोना वायरस की बीमारी के अलामतें हैं तो अपने डॉक्टर से बात करें. आपकी ब्लड शुगर और कीटोन्स की रीडिंग तैयार रखें. पानी कितना पीते हैं उस पर तवज्जो दें और आप क्या अलामतें महसूस कर रहे हैं उसको नोट करें. अगर आपको छाती में लगातार दर्द हो रहा हो या सांस लेने में तकलीफ हो रही हो, अगर आपके होठ या शक्ल नीली पड़ जाए तो डॉक्टर से बात करें या इमरजेंसी में पहुंच जाएं. Over to you, Kim.
Thank you, Shabnam. This last question comes from a constituent of MP Sidhu's. His name is Mohammed, and he lives with type 1. He's very thankful to you for doing this webinar, as well as for all of your support for people with diabetes, MP Sidhu. He's a grad student at York University and has seen that he can apply for the Canada Emergency Student Benefit, but he would really like to gain some job experience, if at all possible, this summer. And he's wondering whether there are any government resources that can help him find any potential employment. What would your advice be to him?
Thank you, Kim. First of all, Mohammed, we are all going through, troublesome time. And this is also troublesome job market right now, as you know. So, and today is, I think, Friday. Emergency student benefit is started, so you can apply that. It will directly support you $1,250 every, I think, 4 weeks for this summer, and 2000 for students who have disabilities or dependents, or you are helping some senior, then you can earn $500 more. I think it's a great help for students. And other thing you can do, as you know, Canada Summer Job Program this year offering to pay up 100% of the employees' hourly wages. So you can apply Canada Summer Job. You can go to Canada Job Bank, which can be found online at jobbank.gc.ca. And these jobs may offer you some of the experience that you're looking for to start your career, and the funds will help you to move forward. I think I hope I answer your question. I will speak in Urdu. So Mohammed, जैसे कि आप ग्रेजुएट हो रहे हैं, जस्ट कंग्रेचुलेशन, पर लेकिन ये जो टाइम है हमारे लिए बहुत ही कोविड-19 का टाइम, थोड़ा सा जो आप सब जी जानते ही हो कि ट्रबलसम टाइम है, लेकिन फिर भी सरकार की तरफ से जैसे कि आज ही शुरू हुआ है कि एमरजेंसी स्टूडेंट बेनिफिट $1,250 आपको 4 वीक के लिए आप एलिजिबल हैं अगर आप हेल्प कर रहे हो किसी सीनियर्स की या जिसके पास डिसेबिलिटी है, तो आपको $500 और मिल सकता है. यू आर एलिजिबल फॉर $2,000. उसके अलावा कनाडा समर जॉब के लिए आप अप्लाई कर सकते हो. उसके लिए आपको ऑनलाइन जाके jobbank.gc.ca में देखना होगा. सो आप जॉब अप्लाई कर लें तो ये आपको हेल्प करेगा आपके कैरियर को मूव फॉरवर्ड करने के लिए. थैंक यू. ओवर टू किम.
Thank you, Sonia. Now, I think we're nearly at the end of our time together. I thought before we concluded, I might offer each of our experts the chance to just offer any final remarks or conclusions. And perhaps, Shabnam, I could start with you and then invite MP Sidhu to make any closing remarks.
All I can say is that there are lots of resources available, and I think Diabetes Canada is well positioned to offer that information. So please reach out and speak to someone for any help that you need. Also, as far as the government programs are concerned, already MP Sonia Sidhu has been so kind enough to participate and share all the information about the federal programs and all that is possible, and she's willing to go that extra mile to help people with diabetes. So I think we are in a very good position to sort of support our community living with diabetes and COVID if they have COVID-19. Thank you.
So, Kim, I will speak in Urdu first. So, I think it's ये बहुत अच्छा जो वेबिनार था, जैसे शबनम और किम ने जानकारी दी. हम लोग यहाँ आपके लिए जो भी आपको फेडरली क्वेश्चन है, I'm always there. आप मेरे ऑफिस में रीच आउट कर सकते हैं. अगर आप फोन के जरिए और ईमेल के जरिए आप मेरे को ईमेल करें, तो हम लोग बेशक घर से काम कर रहे हैं, लेकिन हमारा स्टाफ और हम आपकी सर्विस के लिए कोई भी आपका क्वेश्चन हो, वी आर देयर टू आंसर यू. सो आज का जो है कि हमने सोचा कि आपको हेल्प मिल सके डायबिटीज कनाडा और शबनम के जरिए, आपको जो और हम लोग जानकारी इंफॉर्मेशन दे सके ताकि आपके लिए जो वो बहुत अच्छी जानकारी साबित हो. इसलिए आप canada.ca में जाके /coronavirus कोई भी है, आपको कोई फंडिंग की कोई आपको जानकारी लेनी है, कोई वर्चुअल केयर की जानकारी लेनी है, जहाँ आप किस चीज़ के लिए एलिजिबल हैं, तो आप वहाँ पे जाके देख सकते हैं. राइट हैंड में एक जो आप आइकॉन दबाते हैं, उस पे आप क्वेश्चन टाइप करके कोई भी आपका क्वेश्चन हो वो भी आप उसके हिसाब से आंसर ले सकते हैं. So this seminar was very good seminar. So I'm Member Parliament from Brampton South. I'm always there to help you. Any federal issue, you can reach out to me, or you can email me at my office. Me and my office team is always there for you. We are trying to work with everyone. So and we can your feedback is very, very important. Government is helping, try to help everyone, businesses, seniors, youth. And today, because I got many emails which is related to the diabetes, that is why this seminar is hopefully is very helpful to you. Any question you have, any feedback you have, as I told, you can always email me. Always, your feedback is very, very important. And thank you for listening today.
Shukriya, Shabnam, Shukriya, Sonia. Thank you both so much for your valued insights and your time today. I'd really like to thank our viewers for being with us. We really hope this has been helpful to you. Please don't hesitate to reach out to Diabetes Canada if we can provide you with any more information or supports, 1-800-BANTING, or visit our website, diabetes.ca. And I wish you all the very best. Thank you and be well.